With limited true treatment options, feline chronic kidney disease can be very frustrating and absolutely heartbreaking, but veterinary medicine is changing fast. Don't let your cat miss out on the latest advancements in kidney disease management options. For years, cats were treated as small dogs, and that's no longer the case. Stay tuned as I discuss some of the more exciting advancements that we have made in feline chronic kidney disease and that are yet to come. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. Historically, drug companies didn't see a financial benefit to studying cats and treatment options specific to them. Well, things are finally changing. With independent feline advocate groups and things like the Feline Veterinary Medical Association, continuous advancements in veterinary medicine are leading to new diagnostic tools and management strategies, which can significantly improve the quality of life of your cat with chronic kidney disease. First, let's talk diagnostic advancements. This has been an area where we've struggled for a very long time because our traditional blood markers, the BUN and creatinine, that we so focus on with cats, elevate at a very late stage in the disease process. We're gaining more and more early diagnostic markers that are helping us identify cats that either have CKD before the BUN and creatinine rise or are at risk for it. And we have two categories. There's the predictive diagnostics. So this is essentially an AI tool that is taking the common tests that we run on cats, analyzing 6 different parameters and telling us whether or not that cat is likely to develop chronic kidney disease in the next 2 years. According to Antech, this technology is 95% accurate. We also have blood biomarkers. So there's something called an SDMA. The SDMA detects kidney function decline far earlier than creatinine and BUN will. It can be affected by other things going on in the body, so it's not 100% accurate, but it can be something that makes us tune in a little bit closer to that cat and what their kidney parameters are doing, called the FGF23. This regulates phosphate levels in the blood, and this gives us an earlier look into how phosphate may be affecting kidney health. And this is just the tip of the iceberg. You know, if we're able to come up with AI tools and advancements in blood biomarkers, there's other things in the pipeline. Another category of advancement has been the pharmaceutical interventions. Some of the drug manufacturers are finally seeing a financial benefit and trying to help our feline patients. They're starting to realize that cat caretakers hate medicating their cats, that cats hate taking their medications. So they're looking into ways to streamline how we are doing this, and one of these can be seen in a medication called Telmisartan. This not only can help with high blood pressure issues, it can also target protein loss through the kidneys. We know cats that are losing protein through their kidneys have a poorer prognosis than those that don't. So being aggressive about treating these problems can definitely help extend the lifespan of the cat and improve their quality of life. There's also new knowledge in the appetite stimulant category. So there's a drug called Elura. There's also mirtazapine, known as Mirataz. One of the frustrating components of kidney disease is the cat doesn't always feel good enough to eat, or eat well, or eat what we want them to eat. So knowledge in the category of these appetite stimulants can lessen the stress of trying to convince your cat to eat something, or just keep them eating regularly. In fact, during the filming of this video, Ohio State is in the process of studying mirtazapine and how it affects quality of life in cats with kidney disease. If you think your cat could benefit from an appetite stimulant, I would encourage you to talk to your veterinarian. There are some limitations on when we want to use these medications, so it's important to know if your cat falls into one of those categories or not. There's also the category of our phosphate binders. Traditionally speaking, aluminum hydroxide has been the go-to, but studies are showing that might not be the best option. And now we have companies looking at and producing options that are similar to some of the phosphate binders that we use in humans with chronic kidney disease. So even the phosphate binder category may be getting a major overhaul really soon. A product called Porous One, which has been through a couple of studies and is ongoing through more studies and is showing incredible promise in our cats with chronic kidney disease. Porous One will actually bind the uremic toxins in the gut so that they never enter the bloodstream. Most cats seem to take to it pretty well, so it's not a battle to get it into them, and it tends to make them feel pretty good when those uremic toxins aren't being absorbed. Currently, both Texas A&M and Ohio State University have studies around this particular product. For the first time in a long time, we also have another player when it comes to anemia management and chronic kidney disease. Traditionally, we've had to use ESAs, which is basically an artificial way to increase the hormone in the body needed to produce red blood cells. Now we have an option in Varenzin CA1 that actually stimulates the cat's own body to produce the hormone needed, so we're less likely to get immune reactions to it, and we can start it earlier in the process. So the ESAs we used to use only when we absolutely had to, when we were backed into a corner, because at some point it is known that they're just no longer going to work. But we also know that cats that are anemic don't feel good because of their anemia. So the sooner we can safely treat it, the more likely that cat is to feel better. The Varenzin CA1 offers us that option of beginning to treat the anemia far sooner than we traditionally would with the ESAs. Let's switch gears a little bit now and go towards the nutritional development aspect of things. So traditionally, therapeutic or prescription diets were the go-to when it came to cats with kidney disease. And they still are for many, but the diets have gotten an overhaul. These diets that used to be severely restricted in a lot of things have now been adjusted to our current knowledge of chronic kidney disease. There are ongoing studies that are looking at different ways to approach nutrition and chronic kidney disease. And there are different formulas, meaning we have early formulas and advanced formulas. With so many things cat related, if we can treat it with nutrition, it's going to be far simpler than trying to shove a bunch of medications and supplements down their throat. Currently, Cornell has a study going on that is looking at alternative options for nutrition in cats with chronic kidney disease. The old standby of severely restrict A, B, and C so that these cats live longer is being revamped with all of these current studies. Hydration is also getting an overhaul. We're learning more and more about how cats drink, why they are ineffective at drinking, and what we can do about it. So a newer product called HydroCare has come out, which is more like a gravy than it is water. So it entices cats to drink it, but because it's thicker, they can more effectively drink it. So we've known for a very long time that if a cat will physically drink their water requirements, that's going to be a better scenario than having to give them subcutaneous fluids under their skin. But we haven't come up with great options for that. And now in the new HydroCare product and the studies that are coming behind it, we're getting all sorts of exciting information on how to address dehydration in our cats as well. And as I had mentioned earlier, cats are finally getting their day in the research studies. There are a lot of studies ongoing, and because of that, there's a lot of information coming at us really quickly. There have been some studies done with stem cells to hopefully either regenerate or repair the kidneys. Nothing has been finalized there, but the research is ongoing. There's also a study called the Reverse Study by Trivium Vet that is just getting rolling. This one looks pretty promising as well. And Cornell and Ohio State have both thrown their hat into the ring and are really pumping up how many studies they do specific to chronic kidney disease in cats. So who knows what's going to happen in the next 6 months, year and a half, 2 years. There's just so many exciting things going on right now that you really have to stay tuned to what's changing. Two additional categories that haven't always been big players in the arena are what I would consider the integrative therapies. So that's things like supplements, pulsed electromagnetic therapy. There are a couple studies now that have come out showing a combination of peptides and amino acids is very promising for our cats with chronic kidney disease. And while there are tons of supplements on the market, very few of them have any sort of research backing them, and the majority of them don't have great quality control. So to see a supplement come down the pipeline that does have studies backing it, even through the major universities, is pretty cool and pretty significant. As far as the pulsed electromagnetic therapy, that was always traditionally used for arthritis, and I still encourage it as a non-drug option to treat arthritis. But we're also seeing some anti-inflammatory effects whole body, which if you have a cat that has kidney disease that is either based in inflammation or caused by inflammation, something like the pulsed electromagnetic therapy could also be very beneficial for your cat. And then we've also become much more mindful about the home environment of our cats. We know that stress plays a part in bladder health and inflammation, and blood can be found in the urine because of it. This can also affect the kidneys. So we want to make sure that our cats have a great home environment. We want to make sure they're not stressed. We want to make sure they have easy access to their resources. And we want to be very mindful about their behavior when it comes to eating, drinking, and using their litter box, because all these small day-to-day things can give us huge clues into what's going on or what might be happening in the future. So even though we don't have a great your cat has been diagnosed with chronic kidney disease, here is the treatment plan scenario going on, we do have a lot of things that are changing, and they are changing quickly. And hopefully some of them will be available to help your cat either now or in the near future. And that not only plays out in our new blood biomarkers that we're seeing, some of the new medications that have been developed, anemia treatment options, phosphate binders, hydration strategies, and we're finally digging into nutrition and how we can tweak it to help with chronic kidney disease, or maybe even prevent it going forward. So if your cat has chronic kidney disease, I would encourage you to stay in close contact with your veterinarian and ask them, what are the latest studies? What is the latest information? Maybe there's studies that you want to participate in if they're in your area, such as the reverse study. Staying on top of this and communication are going to be key in gaining benefits from all of this information for your cat with chronic kidney disease. And if you're looking for more information on things like Varenzen CA1 or Porus 1, I have created videos on those, so go check them out.